Hello, my name is Melody Campbell and I will be presenting my disease project today for microbiology. I have chose the topic stomach ulcers, also called peptic ulcers. H. pylori is a bacteria that is a gram-negative, spiral-shaped with flagellate that colonizes in the gastric mucosa. And this is the disease that causes the peptic ulcers. They are caused by Helicobacter pylori, also called as H. pylori. Culture and isolation. H. pylori is cultured by a tissue sample in a specific dish with nutrients that it is normally found in. Isolation is done via the different culture medias that can be non-selective or selective. A few of the most common medias are Brucella and Columbia. How H. pylori is acquired. It's acquired from saliva via person-to-person contact. It is acquired in untreated water and also food contaminated with feces. Causes of this disease. H. pylori causes the peptic ulcers when the bacterium causes inflammation within the lining of the mucosa in the stomach and duodenum, and the lining weakens. The acids and bacteria are able to get in the linings of those areas. Then the bacterium can survive in the stomach, which is an acidic area, and it can survive in that area. Signs and symptoms. Signs and symptoms of peptic ulcers, which are caused by H. pylori, are intermediate abdominal pain, bloating, weight loss, loss of appetite, nausea, and vomiting. Diagnosis. H. pylori is diagnosed via endoscopy, in which you will be taken to the operating room and they will put scope down your throat and your esophagus, and they will scope you there. That's what's called an endoscopy. They can also do what is called a urea breath test. They can do it in stool studies where you'll collect a sample of stool and then they'll take it to the lab and culture it. And also biopsy of stomach tissue can be done via pathology, and how they get those biopsies or when they go in and do the endoscopies. Treatment. Treatment for H. pylori includes antibiotics, proton pump inhibitors, H2 blockers, and Pepto-Bismols. And most of treatment requires a 2-week course, which taking these medicines at least 3 or 4 times a day. Prevention of H. pylori. Good hygiene, especially washing your hands and keeping the hands clean. And that's basically it with the good prevention. Proper hygiene, proper hand washing, is making sure you're in areas where it is sanitary, where they have good clean water. And that's my presentation of stomach ulcers, also called peptic ulcers, which are caused by H. pylori, aka Helicobacter pylori.